Hello everyone, I hope you are doing well. Here I am after 2 weeks doing my Friday post. Actually, it's a Wednesday post because I forgot that I am on vacation starting tomorrow and I will be back on the 30th of September to answer all your mails, SMS, posts, everything that you are writing to me. So now, after this video, I'm really on a vacation mode. But now I'm happy to talk about season 2, Did You Know, episode 5, about diabetes type 2 and about the two hormones, insulin and glucagon, and the representation with psychosomatic. What is the link and how we can look at it outside the box with another perspective. So diabetes type 2 is a chronic disease which is representative by an insulin resistance. What means insulin resistance? It means that the insulin is no longer working properly and is no longer regulating the blood sugar in a proper way. Lack of sports, lack of sleep, the way our lifestyle, the way we are eating fast food, junk food, or the system of our lifestyle. But let's make a more zoom focus on the hormone insulin. So insulin is regulating the blood sugar, and with the insulin, it means the father, the mother is the glucagon. So the insulin is in psychosomatic the representation of how we are absorbing our emotions, and the insulin is controlling the blood sugar, so means how we are controlling our emotions. How are we controlling a situation? Are we control freak? Are we letting go? How we are facing our challenges? And it is as well how we are facing the sweetness of life. So when we are eating sweets, we have a glucose spike, and then with time, if we are not taking care of it, we can be insulin resistant. So how we are dealing with the sweetness of life? How are we dealing with our emotions? Are we eating them or are we dealing with them? And let's go and see the glucagon. The glucagon, which is a representation of the mother, very interesting. The glucagon is the hormone which is taking from our inner sources. So from our stock, it's taking the glucose and releasing it into our blood whenever we need some sugar. And the representation in psychosomatic, how are we using our inner resources in order to face challenges? Are we in a survival mode? Are we in a struggling mode? How are we facing our stress, our lack of our crisis? So the glucagon is how we are mobilizing our inner sources, our inner resources regarding and facing the lack of emotions, the lack, how we are facing crisis, how we are facing the lack of support, and how we are facing challenges. So the insulin is the balance of our emotions, love, seeking our love, seeking the sweetness of life, let's say it this way. And the glucagon is how are we dealing with the lack of love, the lack of emotions, a crisis, a challenges, our blockages. So these two hormones are working in symbiosis, and when one is deregulated, the other will be deregulated as well. So if you want to know more, just book your first 15 free minutes free consultation, and I will be happy as well to see how I could support you. For now, I wish you a wonderful evening, and we see us in October. Bye, everyone.